So now we're going to go through an introductory overview to the SJT's scenarios and also questions. This is going to involve going through broad scenarios, question types, and also a systematic approach of how to deal with these scenarios and questions. So in the SJT, there's 7 broad scenario types. Firstly, confidentiality, so maintaining and promoting the privacy of patient information. Professionalism, all the things that go with the job and how we behave. Teamwork, how we work with others and communicate. Non-compliance, so the respecting a patient's right to refuse treatment. Distressed patients, medicine's really a high-stakes environment, and encountering distressed patients is quite common. Miscommunication and conflict, it really comes back to teamwork as well, but just where miscommunication happens, conflict usually arises. And also coping with pressure. So medicine is also a high-stakes environment, so being able to deal with pressure and remain calm is also critically important. So you'll find in the situational judgment test, no matter what scenario you get, you will be able to sort of slot it into at least one or maybe multiple of these broad scenario types. So following a scenario, you'll be given a question below. Usually it's going to be appropriateness or importance. As we saw in the previous video, this is usually the outlay, and you're followed by 4 different options. We might go through an example because this is going to be the best way to be able to break this down. So here on your slide, you'll be able to see a scenario followed by a question, followed by a response, and 4 response options. So in this scenario, we have James, a student who has noticed his close friend and classmate Frank seems down. When prompting Frank to see if he's all right, James's classmate confides in him that he has plagiarized a large part of an important assignment that he submitted last week. He's feeling guilty about this and begs you not to mention this to anyone. He is relieved that he's told someone about this, and he's got the feeling of guilt off his chest. Frank also mentions to James that he's been struggling with time management, experiencing higher than normal levels of stress, and trouble sleeping. You can see that there's multiple elements to do with this scenario. While this isn't a medical scenario, this is 2 classmates in university most likely, we can see that this might fit into multiple different broad scenarios because these elements of medicine are still relevant. So we have confidentiality, someone's confided in you. We also have professionalism, not wanting to condone plagiarism. But we also have maybe distressed patients where you have a classmate that's quite distressed and needs some help. So you can see here that there's multiple different elements that are at play. Following this scenario, we're asked to determine how appropriate the following response would be for James specifically in this situation. In this response, we have reporting this incident to the subject coordinator as soon as possible. While we're not going to answer this directly right now, I really want you to have a think about the different elements in this scenario that would enable you to be able to answer this. Think about James's role in this scenario. He's Frank's friend. Think about the plagiarism. Should he be condoning this or not? And also think about Frank's sort of trust in you to confide that he is struggling, that he has plagiarized. As you can see from the previous example, there can be multiple different elements to do with the scenario and also questions. The best way to approach these scenarios is really to find a systematic approach. Here at Phrases, we have a 5-step approach that we think is the best to breaking down scenarios and also questions and responding. So firstly, we have identifying your role. This is really critically important to influence how we should respond to a certain situation. And we have 5 major role types. We have a non-medical, so maybe a student or someone in the community. We have a medical student, an allied health professional or a nurse, a junior doctor and a senior doctor. And really, this role really governs how we should or would act in any given scenario. And don't forget, this is really about how you should act given your role, not how you would act personally. This is an aptitude test, not a personality test. Moving on, we have stakeholders, so really identifying who is important in the scenario. 4, identifying critical issues, so major problems, but also distractors, so secondary problems that might not be as relevant as the major problem at hand. So in the last step as well, choosing a response option. So it's really important to define what these response options mean in context of the scenario. And also a couple more tips here, understanding that these are independent of one another, and also there's no chronological order for these responses. So check out our next video for some more in-depth understanding of choosing a response option.